There's a food that's really good for fatty liver disease. Most people eat it, but they do it the wrong way. They end up losing all the benefits, all the nutrients. I'll tell you what it is and how to eat it the right way. In this video, I'm going to talk about fatty liver disease. What causes it? What are the risk factors? How to reverse it? 5 foods you should eat that are good for fatty liver proven by science. Are there any drug treatments? Is there medicine for fatty liver disease? What are the 5 foods you should avoid? Are they forbidden for fatty liver disease? So everything about this condition, if you have symptoms, if you don't, leave your like. Let's make a goal of 75,000 likes for this video. 75,000 likes. The last one had 74,000. So I want this video to be the record holder for the most likes on the channel. That way, YouTube knows that the video is relevant and ends up sending it to more people. There are millions of people with fatty liver who need this information. Many end up not getting access to quality information and hence don't improve their fatty liver. So please like the video and more importantly, activate the bell. If you click on the bell and check all options, YouTube will notify you every time I post a video. Sometimes you're subscribed, but don't get to see the content because you're not notified. So keep it activated and continue following. And fatty liver is when there's an accumulation of fat in the liver. How much fat accumulation? More than 5%. It's divided into 3 stages. Stage 1 is mild, stage 2 is moderate, and stage 3 is severe. What are the risk factors for fatty liver? For fat in liver cells known as fatty liver. Firstly, obesity, genetics, a sedentary lifestyle, a diet high in fat, sugars, and simple carbohydrates. All these contribute to the buildup of fat in the liver. It's also related to metabolic syndrome and other diseases like type 2 diabetes, hypogonadism, hypothyroidism, and polycystic ovary syndrome. These are diseases that increase the risk of metabolic syndrome because they also have something in common: obesity, such as in the case of type 2 diabetes. High triglycerides is also a condition linked to fatty liver disease. If fatty liver has symptoms, most times it doesn't. So patients are usually symptomless, especially in the early stages. A few will have symptoms. What are these symptoms? Pain, primarily in the so-called right hypochondriac region on the right side, just below the ribs, gas, bloating, fullness, poor digestion. Another thing, you could have jaundice, which is the yellowing of the eyes and skin. The person might get very swollen, have what's called ascites. The legs can also swell up, and there might be clotting disorders. Is fatty liver disease common, a frequent issue? Fat in the liver? Yes, it's very common. About 20 to 30% of the population, and it occurs at all ages. Of those who have it, of those millions with fatty liver disease, it is estimated that 1 billion people worldwide, 1 billion people around the world have fatty liver disease, and of those, about 20 to 30% will develop what's called steatohepatitis. Why? When it comes to hepatitis, many people immediately think of hepatitis C, hepatitis B, viral diseases, but the accumulation of fat can also cause inflammation in the liver. Then the suffix itis, when it ends in itis, like bronchitis, tonsillitis, gastritis, it means inflammation. So it doesn't mean that it comes from a viral origin, as they say. Fat in the liver can indeed inflame the liver and even alter some tests like TGO and TGP, which are markers of liver injury. It can hurt the liver to the point of causing fibrosis, causing a scar. If not corrected, this fibrosis problem becomes cirrhosis and also increases the risk of cancer, hepatocellular carcinoma. So what's the problem with fatty liver disease? It can inflame the liver. This inflammation can become a scar, fibrosis. This fibrosis can become cirrhosis, and then you'll have all those consequences. Why? What's the function of the liver? To eliminate toxins. So when you eat, the liver ends up doing all the detoxification. It's essential for that. Also, cholesterol and clotting factor synthesis, it produces clotting factors and supports our blood. So if liver function is absent, your body loses its ability to eliminate toxins. to detoxify itself. Another point, it's also involved in the synthesis and regulation of protein production like albumin, crucial for keeping your body functioning and maintaining your nutritional health. It also regulates glucose. The liver can produce glucose and is also part of that metabolism, that regulation of blood sugar. So the liver is fundamental for living and body detoxification. It allows you to eat and take medication without poisoning yourself, for example. If the liver starts developing fibrosis, scars, or cirrhosis, it loses its ability to perform its functions. You start to exhibit symptoms. That's why it's crucial to prevent and reverse this process. I haven't spoken about the risk factors, but alcohol also causes liver fat. Patients who consume a lot of alcohol almost all the time, which is significant. In medicine, it's hard to say all the time, but when it comes to liver fat and also consumption, excessive alcohol, it's almost always the case. So the important risk factor is alcohol consumption. Does the liver regenerate? Yes, it can perform this function. It has this characteristic. If you remove half of your liver, for example, it can regenerate. Now, what's the crux of the matter? Chronic damage. If you hurt it every day, like with liver fat, which ends up hurting it and can inflame it, it loses this characteristic. Why? Again, what I explained ends up becoming fibrosis, a scar, and also cirrhosis. In these stages, it can't regenerate. Here's the main point. So, with chronic damage, the liver doesn't handle it very well and cannot regenerate. And now, how do we reverse this process? What should you do? I'll tell you 5 foods to avoid, never to consume, 5 that you should prioritize. Recall the one I mentioned at the beginning, that you're probably consuming incorrectly, losing all the benefits. There are 5 pillars in treatment that involve how to do the reversal, especially in the early stages. So how do you reverse it? What should you do? 5 things. First, physical exercise. At least 150 minutes per week. Ideally 200, but if you do 150, it could even be walking. Then push your limits. It'll also depend on your physical fitness. But 150 minutes is an excellent goal and helps you in this process. Number 2, the second pillar is losing weight. Losing 5% of your weight, if you manage a bit more, will also assist you. It is proven that reducing weight aids in the treatment of liver fat. And here, very important, this reduction needs to be gradual. Sudden weight loss can boost the steatohepatitis process, potentially causing increased inflammation in the liver. It can be more aggressive if you lose weight abruptly. So it has to be gradual, very slowly. Sharp reductions worsen this process, so be very careful with this pillar. You might think you're doing something beneficial, but you're actually hurting yourself. So gradual weight reduction, 5%, is a very good target. If you manage a bit more, there's even greater benefit. Third pillar, diet. The Mediterranean diet with olive oil, fibers, vegetables, and fish can also help in this process. Well then, diet is very important here. I'll talk more about this, but I've pegged it as one of the key factors because diet is crucial. Number 4, stop drinking alcohol. Avoid it. Alcohol is taboo. Well, taboo is a strong word, but with regards to fatty liver, dodge alcohol. Dr. John, but I rarely drink. Just 1 can a week. But even that can harm your liver, inflame it more, and seriously exacerbate this process. But once a month? Also, no amount of alcohol is safe when it comes to inflammation in the liver from fatty liver. So, stop the alcohol. It's very important. Supplements and teas. Always consult your doctor or nutritionist because there are many supplements and teas that can damage your liver, just like medications. Just because it's natural doesn't mean it doesn't have side effects, just like medications. Another thing, whenever you go for consultations, say, look, I have liver fat, because there are some medications that cannot be used in hepatic steatosis or when the patient already has liver damage. So it's very important that you always mention it, even if you think it's not significant. Speak up. It won't harm. On the contrary, it'll do good. It'll help you. Well then, number 5, treat associated conditions. Do some research if you don't have a disease that might be worsening this, like hypothyroidism, increased triglycerides, or metabolic syndrome itself. So these are the 5 pillars. It's very important that you adhere to all of them to have a much higher chance of reversing and even controlling the disease if you are at a more advanced stage. Now, there's a medicinal treatment, drug treatment, for patients who have biopsy-proven fibrosis. Some medications can be evaluated. For the patient who doesn't yet have fibrosis, who has mild hepatic stenosis, there's no evidence that the drugs can work. What's being studied for this group? First, pioglitazone, a medication used for type 2 diabetes. What's the issue here? Pioglitazone can worsen heart failure. It can worsen a weak heart. If you have osteoporosis, it can also cause an increase in weight, a redistribution of fat. In that case, it ends up being beneficial in some cases for the fatty liver, even if you gain weight. It sounds a bit contradictory, but it ends up working for a select group of patients. Vitamin E also, always remembering that the patient already has to have proof that they have fibrosis. In some cases, supplementation with vitamin E can also help. What's the big con here? The risk of bleeding, so always do it with medical monitoring. Analogs of LP1, Saxenda, Trulicity are also being studied, but there's no proof. Victoza, Ozempic, for example, are analogs of LP. Another thing, metformin, especially if you are affected with insulin resistance, metabolic syndrome, type 2 diabetes, treatment of other diseases that can harm, as I said. If you don't have any other conditions, metformin doesn't work either. So you have already seen that drug treatment still needs to evolve a lot. The main thing is that you do these 5 things and take care now of these foods that I'm going to give you. 5 foods for you to avoid, for you not to consume, forbidden in hepatic steatosis when it comes to fat in the liver. Number 5, processed meats. So, salami, sausage, pork neck, what else? Ham, these processed foods, turkey breast, also have a reputation for being healthy, but for liver fat, avoid this type of food. Number 4, saturated fats. So, yellow cheeses, ice cream, fatty meats, avoid this kind of food because it exacerbates the process of hepatic steatosis. 3, foods with a high level of sodium of salt. Be careful with salt. Even if you don't add salt to your diet, look to see if you are not eating a lot of processed foods, like instant noodles, condiments, ready-made sauces, ketchup itself, mayonnaise. Look if you don't have a high amount of salt of sodium, mostly you do have. There are some exceptions as well as ice cream, but pay attention to this if possible, avoid it. Number 2, refined sugars, simple carbohydrates. When the doctor says carbohydrate, he is referring to sugar because the body absorbs the carbohydrate and it turns it into sugar. So flour, mainly breads, pasta, if you want to consume them, opt for whole grain foods. Avoid if you can. I'll mention what you should consume, don't worry, but when it comes to hepatic steatosis, care needs to be taken. I'm not going to include alcohol here because I've already said you should cut it out. Number 1, corn syrup, starch syrup, fructose syrup, glucose syrup. Check to verify you're not eating these. Even if you don't personally use them, look out for sweetened foods primarily. So avoid glucose syrups, cornstarch. It's prohibited when it comes to liver fat. And now, Dr. John, what to eat? 5 foods that are proven to help. Number 5, fruits. Oh, but doesn't it have fructose? Doesn't fructose make it worse? No. Then you'll also have to eat something, as I said. What are the fruits that are good and have evidence that they can improve fat in the liver? Acai, for example. So just be careful here because there have been cases of contamination with acai due to Chagas disease. So always pasteurize so you exclude that possibility. Another fruit, Araca, guava, avocado, which also has monounsaturated fats. So fruits, put them in your diet. Number 4, fish, especially deep water fish, so tuna, salmon, which are rich in omega-3. This also helps with fatty liver. It is very good for those who have it if they have liver cough. Number 3, oats, flaxseed, chia. These are fibers that assist you in this process, so include them in your diet. Oats also have evidence that they can improve your lipid profile and cholesterol. Number 2, turmeric and saffron. When I talk about turmeric, I don't mean those supplements or capsules, so opt for eating turmeric. This can also help you. There's evidence in scientific studies that it can assist in this fat treatment process in the liver. And number 1, our highly anticipated item on the list that has scientific evidence that it improves liver fat, improves this whole process, that can help a lot, just that most people end up consuming it the wrong way. It's coffee. But why the wrong way? There's a correct way to consume coffee, to store coffee. So to preserve antioxidants, tocopherol, vitamin E, for example, flavonoids, you need to keep the coffee in an environment that doesn't have moisture, doesn't have sunlight, and also can't have air contact, because oxygen can take away these benefits. It can oxidize the coffee. So it's very important. Here's a tip. If you buy a packet of coffee, buy it in beans. What's up? This really is not an ad. This part here you have to keep facing down. So usually it comes on the bottom and you open the coffee upside down. Then you leave this part here closed. You'll open it on the other side. That way you'll preserve the coffee in the best shape. You can, for example, grind the coffee beans. That's a strategy for preserving the vitamins and nutrients too. Store it out of reach of light and sunlight. Not just sunlight, but light in general. Keep it away from oxygen. If possible, buy it in bean form. Don't store it in the fridge, because that way you'll enjoy the benefits of the coffee. Otherwise, it ends up basically preserving the caffeine. That's why you feel the effect of coffee. You're actually feeling the effect of the caffeine, but you end up losing all the antioxidants. Please like the video if this is a new tip for you. Also, enable the bell if you think this video was worthwhile. What's the next video you're going to watch? It's going to be about teas. Do you remember me saying there are teas that people with liver disease should avoid? So in this video here, I talked about that. Don't forget to watch it. Bye for now.